Greetings. Today I'm going to discuss, does hormone replacement therapy really help with aging symptoms? Aging may be a natural part of life, but for many people, the noticeable changes like fatigue, mood swings, weight gain, memory issues, and a decline in sexual health are unwelcome. Many such symptoms are not due to aging alone. Rather, they result from less than optimum lifestyle choices that contribute to declining hormone levels. All hormones, other than cortisol, decline with age, but they don't have to. Bioidentical hormone replacement therapy, BHRT, has become a popular option for addressing these symptoms. But does it really work? Let's explore the science, benefits, and important considerations related to hormone replacement/balancing therapy and how it can slow biological aging. If we haven't met already, I'm the digital avatar of Dr. Max McLeod, aka the Nutrition Ninja Doc, founder of MyBodySymphony.com and ARTC.health. While he continues to research and explore new and better ways to help his patients achieve their health, performance, and appearance goals, I'm here to convey his knowledge and insights about health, healing, and regeneration. Doc Max believes in using technology constructively to help each other. That's why he uses this AI-generated avatar to educate and inform. Before we get into it, please leave a like on this video if you find it helpful. And if you haven't already done so, please hit that subscribe button because it goes a long way toward helping spread these health-related presentations to more people. Hormone replacement therapy involves supplementing the body with hormones that naturally decrease over time, most commonly estrogen, progesterone, and testosterone. The thyroid hormone is another key hormone that often needs to be supported. For women, HRT is often used during perimenopause and menopause to relieve hot flashes, night sweats, vaginal dryness, and mood changes. BHRT can also be used long-term in postmenopause. Often, women can also benefit from small amounts of testosterone. Few people realize that a woman produces more testosterone during her life than estrogen. For men, testosterone replacement therapy, TRT, may be prescribed to combat fatigue, low libido, muscle loss, and reduced motivation associated with andropause or age-related testosterone decline. Unfortunately, although this has typically been applied to men over 50, there is now a large percentage of younger males with low testosterone levels. There are many factors that contribute to hormonal imbalances, including the huge amounts of toxins, pesticides, and harmful radiation produced by everything electrical. I'm a much bigger fan of bioidentical hormone replacement therapy, BHRT, than the standard synthetic and non-bioidentical hormones typically used by conventional medical providers. These are made to be identical to those that are naturally produced in our bodies. Many are plant-based compounds that closely mimic natural hormones. Many experts believe that this provides much greater benefits with fewer potential side effects compared to the non-bioidentical versions. Hormone replacement isn't a magic cure for aging, but it can significantly improve the quality of life for many individuals. It is also one of the foundational elements of age reversal practices. Some potential benefits include 1. Improved energy and mood. Declining estrogen and testosterone levels can lead to fatigue, irritability, and even depression. Balanced hormone therapy often restores emotional stability and mental clarity. 2nd, better sleep and stress control. Hormones like progesterone and estrogen influence sleep quality and cortisol regulation. Many patients report more restful sleep and reduced anxiety after starting BHRT. 3, enhanced sexual health. Low estrogen or testosterone levels commonly cause reduced libido or discomfort during intimacy. Restoring hormonal balance can revive sexual drive and performance in both men and women. 4, stronger muscles and bones. Hormones play a major role in maintaining muscle mass and bone density. BHRT can help reduce muscle loss, improve strength, and lower the risk of osteoporosis. 5th, healthier skin and hair. Estrogen supports skin elasticity, hydration, and collagen production. Many people notice improved skin texture and thicker hair after hormone therapy. Research supports that HRT can relieve many menopause and age-related symptoms. For instance, studies show estrogen therapy effectively reduces hot flashes, night sweats, and mood imbalances. Testosterone therapy in men with clinically low levels can improve energy, muscle mass, libido, and mood. However, results can vary. HRT works best when hormone levels are carefully tested, dosages are individualized, and therapy is monitored by a qualified healthcare provider who is knowledgeable in this area. While HRT can be highly effective, it's not for everyone. Some studies have linked certain types of hormone therapy, specifically with high doses and synthetic versions, to increased risks of blood clots or stroke, breast or prostate cancer, depending on therapy type and duration, gallbladder issues, or cardiovascular issues. Note that these were associated with non-bioidentical synthetic or foreign forms of estrogen and progesterone. BHRT is not associated with any of those issues. That's why it's essential to have regular follow-ups, hormone level testing, and work closely with a healthcare professional who specializes in bioidentical, personalized hormone therapy. Whether you're on hormone therapy or not, lifestyle plays a huge role in maintaining hormonal and overall health. Eat a nutrient-rich diet with healthy fats, antioxidants, and lean protein. Exercise regularly to promote muscle strength and balance hormones naturally. Manage stress and get enough sleep for a better hormonal rhythm. Avoid endocrine disruptors found in plastics, cosmetics, and processed foods. These habits complement hormone therapy and help maintain results long-term. Hormone replacement therapy can be a powerful tool to ease the symptoms of aging, from low energy and mood swings to declining sexual health and bone loss. When prescribed responsibly and monitored carefully, HRT often helps people feel younger, stronger, and more balanced. However, it's not a one-size-fits-all solution. The key is personalized treatment guided by testing and medical supervision. Combined with a healthy lifestyle, hormone therapy can help you age not just gracefully, but vibrantly. Of course, there's more to optimizing health than hormones alone. To help put things in proper perspective, I've developed something I call the 6 pillars of health and the 5 M's of healing. Enhancing and optimizing each of these will have a huge positive impact on your health. These are the kind of things that we look at when making hormonal balancing recommendations. 6 pillars of health: 1. Sound body structure. 2. Proper nutrition. 3. Appropriate exercise and physical activity. 4. Sound sleep and recovery. 5th. Mental attitude, stress. 6th. Environment. The 5 M's of health and healing are: 1. Microvascular health. 2. Mitochondrial health. 3. Metabolic health. 4. Muscle metabolic reserves. 5. Membranes. As always, reach out for more information about our health enhancement programs, including bioidentical hormone replacement and peptide therapy. Call 9418-065511.